Hello, and welcome to today's video. We will be talking about a very significant issue for seniors, sleep disorders in seniors, and how they are connected to heart disease and memory. Sleep is essential for health, and for seniors, not sleeping well can cause many physical and mental issues, including the risk of heart disease and memory problems. In this video, we'll discuss how sleep issues affect older adults, the connection between sleep and heart disease and memory, and ways to enhance the quality of sleep. Part 1. Common sleep disorders among older adults. As individuals age, they may notice their sleep changing in ways that result in sleep issues. Some of the most prevalent sleep issues in older adults include 1. Insomnia. Insomnia is a common sleep disorder among older people. Insomnia means trouble falling asleep, sleeping, or waking up too early, and not being able to go back to sleep. Chronic insomnia can lead to poor sleep, which is not healthy for physical or mental well-being. 2. Sleep apnea. Sleep apnea is a disorder in which the person does not breathe and starts breathing many times during sleep. Sleep apnea may lead to loud snoring, choking, or struggling to breathe at night. Sleep apnea occurs more frequently in elderly people. Sleep apnea can wake up people several times a night and lower the body's oxygen levels, which may hurt the heart and overall well-being. 3. Restless legs syndrome. RLS. Restless leg syndrome is when a person feels uneasy in their legs and wants to move their legs, especially when they are at rest. This can make it harder for older people to sleep and stay asleep at night. 4. Circadian rhythm disorders. As we grow older, the body's internal clock, or the circadian rhythm, gets disturbed. Elderly people can notice changes in sleeping habits, where they wake up early in the morning and are not able to sleep at night. This can lead to loss of sleep and daytime fatigue. Section 2. The influence of sleep disorders on cardiovascular health in older adults. Sleep disorders are not only annoying, they are also detrimental to the heart. Sleep disorders, including insomnia and sleep apnea, of many years or a lifetime duration, can increase the risk of heart disease in several ways. 1. Greater chance of high blood pressure, also known as hypertension. Poor sleeping, particularly with sleep apnea, can contribute to high blood pressure. Sleep apnea causes your oxygen levels to dip numerous times during sleep, which stresses your heart and blood vessels and can increase your blood pressure over time. 2. Higher heart attack and stroke risk. Sleep apnea has been linked to a higher chance of having a heart attack and stroke. The recurring periods of low oxygen and recurring sleep disruptions can weaken the heart and arteries, causing them to develop heart problems more easily. 3. Making heart disease worse in older people with heart disease. Sleep disorder can exacerbate it. Sleep deprivation can increase stress hormones that cause inflammation in the body and also stress the heart. It can also keep the body from repairing and recovering from heart disease. 4. Heart function issues. Inadequate sleep for an extended period and undiagnosed sleep apnea may damage the heart, leading to heart failure. If the heart does not rest, it may not pump blood properly. Section 3. The effects of sleep disorders on brain and memory function. Sleep is important for the health of the brain. If elderly people can't sleep properly, it affects their memory and their brain function. Here are some of the ways that sleeping difficulty can influence memory. 1. Cognitive decline. Lack of sleep, especially having a sleeping problem, can also make thinking more difficult. Sleep is needed to solidify memories and rid the brain of toxic waste products. When one does not get enough sleep, the brain struggles to create new memories and carry out thinking functions. 2. Heightened risk of dementia and Alzheimer's disease. Studies have shown that sleep deprivation, especially due to sleep apnea, raises the risk of dementia and Alzheimer's disease. Disrupted sleep does not allow the brain to go into deep, restorative phases of sleep that are required for a healthy brain. This can result in the buildup of toxic proteins in the brain, which are linked to Alzheimer's disease. 3. Forgetting things and difficulty concentrating. Sleep disorders can lead to memory issues, like remembering dates, appointments, or names. Sleep deprivation can also become challenging to concentrate and give attention, thus challenging to get through daily tasks or recall important details. 4. Mood swings and depression. Prolonged sleep difficulties can result in mood swings, irritability, and depression. Poor sleep over an extended period of time can damage brain function, making it difficult to manage feelings and causing mental illnesses that also impact memory and thinking abilities. Section 4. Sleeping better and keeping your heart healthy and mind clear. Better sleeping is crucial for elderly people to ensure a healthy heart and a healthy memory. The following are some of the items that can help elderly people sleep and stay healthy. 1. Stick to a regular sleep schedule. Sleeping and waking up at the same time every day will help keep the body's natural clock under control. This is very important for older people who have trouble sleeping. Develop a bedtime routine, such as unwinding by reading or listening to soothing music before bedtime. 2. Create a sleep-friendly environment. Keep the bedroom quiet and cool enough for sleep. The bedroom should be cool, dark, and away from any form of distraction like electronics. If there is an issue with noise, you might consider a white noise machine. Stock footage concept. A middle-aged man or woman redecorating their bedroom to improve it for sleeping. 3. Treat sleep apnea. For older patients with sleep apnea, a SPAP continuous positive airway pressure machine will help to keep the airway open and prevent problems breathing during the night. If you think you have sleep apnea, consult a healthcare provider for diagnosis and treatment. Concept. A older male or female sleeping with the SPAP machine to help them sleep. 4. Exercise frequently. Moderate exercise, such as walking or swimming every day, can help improve sleep and make heart disease less likely. But do not exercise too close to bedtime, since it will affect your sleep. 5. Limit excessive caffeine and alcohol. Alcohol and caffeine will make it difficult to sleep well. Don't consume these in the evening or afternoon if you wish to sleep well. 6. Manage stress and anxiety. Techniques like meditation, deep breathing, or yoga can alleviate stress and anxiety, which are common reasons for sleep disturbances. Stress management is also good for the heart and brain. Conclusion. In this context, sleep disorders in older adults are important. They have a great influence on heart health and memory. Knowing the relationship between sleep and heart disease and mental abilities, and practicing the methods to improve sleep, older adults can preserve their overall health. If sleep disorders continue, consult a doctor to find and treat underlying conditions. Thank you for watching this video today. If this information was beneficial to you, please like, subscribe, and share with someone else. Let's continue looking after our well-being and health as we age. Stay healthy, and see you in the next healthcare videos.